Hello everyone and welcome to the lecture on dental caries. So this is the lecture under oral pathology and medicine for the class of 2024. Now at the outset I'd like to mention that you are already familiar with the topic of dental caries in your preclinical studies, as well as under the Department of Conservative Dentistry and Endodontics you have already been introduced to the concept of ICDAS. So the concept that I would be stressing on here would be on the theories of dental caries as well as the pathology of dental caries. Right. So in this lecture, I would be basically outlining and explaining the topic under the following headings: a brief introduction, which would explain the definition. All right. The etiology of dental caries, under which we will discuss the role of bacteria and dental plaque. Microbiology of dental caries, role of carbohydrates, etiological variables. Okay. Then we will go through the most accepted theory of dental caries. Pathology of dental caries, which delves in to the aspects of enamel caries, dental caries, root caries, arrested caries, and finally immunological aspects of dental caries. Right, so by definition, dental caries is defined as an irreversible, infectious, microbial disease affecting the hard tissue portion of the tooth exposed to the oral cavity, characterized by demineralization of the inorganic component and destruction of the organic component, leading to cavitations. Now, what is important here in this definition or explanation here is the important keywords. So I would like to run you through these keywords so that you are able to remember them and you understand the concept. So first and foremost, dental caries is irreversible. That means once the process of dental caries as the pathology starts, it only moves forward unless there is some uh, intervention that is done. Okay, so that means from the enamel it will progress to the dentine, from the dentine to the pulp, and then it will progress further to involve the periapical tissues. Second important thing is that it's infectious and is caused by and is a microbial disease, right? So it's primarily bacterial in origin, right? So dental caries is caused by the bacteria that is always already part of the normal flora of the oral cavity. Okay, and this bacteria which causes dental caries is infectious. That means if there is an active caries lesion in the oral cavity and you use a dental instrument to actually examine the area, and you use the same area of the tip of the instrument to examine a normal uh, tooth as well, and if the tooth surface is susceptible, then you can potentially inoculate that surface, leading to an new caries lesion over there. So you've got to remember that. It affects only the hard tissues, right? So as we know, it affects the enamel, dentine, and the cementum, that and the root part, right? It's characterized by demineralization. Okay, so the first step in the initiation of dental caries is demineralization, which actually takes place because of the process of uh, fermentation of carbohydrates by the microbial organisms, leading to the formation of organic acids. These acids lower the pH, causing demineralization of inorganic components and then the destruction of the organic components, which leads to cavitation, right? So the common word is I have cavities, right? Which means you have dental caries, right? How does a structure which is even harder than bone actually develop cavities? Well, this is how it happens. There is demineralization that takes place. The inorganic components are leached out, and once that happens, the organic component undergoes destruction, leading to cavitation. Now this is a picture of an extracted tooth specimen, right? So you are seeing amalgam restoration over here. So under the restoration, there's a cavitation over here. This is called secondary caries, right? There are various other terms that are used, clinical terms that are used to describe carious lesions, which you are already familiar with, right? So what has happened basically is under the amalgam restoration, there is leaching, micro leakage that has taken place, and then there is a caries lesion that has got initiated. So obviously, as the definition goes, as we've understood, there has been demineralization of the inorganic component which have leached out. The enamel matrix becomes weaker. The organic matrix breaks down. The enamel breaks down. Similarly, this entire process takes place in the dentine as well, and then it has led to this deep cavitation. This is now a diagrammatic representation of the progress of dental caries, as I just mentioned while I was explaining, right? So as if you look at it as an irreversible process, right? As the fact that it is irreversible, once it commences in the enamel, it destroys the enamel, goes down to destroy the commence destruction of the dentine, right? Using the same principle of demineralization first, and then destruction of the organic component. Eventually, it will affect the pulp, right? So the pulp is the vascular component that is present, which gives the vitality of the tooth, which maintains the vitality of the tooth. And once it affects the pulp, all right, the infection spreads further down, affecting the periapical area, where it gives rise to various different periapical pathologies, which we will discuss as we move forward. Right, so let's look at the etiology. When we look at etiology, the accepted theory for dental caries is etiology was acidogenic theory, which was given by W.T. Miller in the year 1889. And what he said was the acid formed by the fermentation of dietary carbohydrates is of the dietary carbohydrates by the oral bacteria leads to progressive decalcification of the tooth substance with subsequent disintegration of the organic matter. Okay, now while I'm explaining the etiology, I'm also going to take the liberty of explaining the theories together, right? Now, in the concept of dental caries from the earlier days, it always puzzled uh, mankind that how was caries forming, right? So there are many theories that were proposed, some that are not relevant today, but it's just good to know the name. All right, so there were various different names. There was chemoparasitic theory. There was this acidogenic theory, which was given by Mr. W.T. Miller. And currently, the most accepted theory actually is something called as the multifactorial theory. So I will explain that as we move forward, and how actually Miller's acidogenic theory was the foundation of the most accepted theory, to which progressed to become the multifactorial theory in the modern actually times. According to Miller's acidogenic theory, dental caries basically requires you need susceptible tooth surface, you need cariogenic bacteria in the oral cavity, and then you need to actually the person needs to be consuming dietary fermentable carbohydrates, especially high in sucrose, which is called cariogenic diet, and that gives rise to caries. Okay, but over the years, what was identified was that it is not sufficient to have just these three factors. It is also very important that these three factors have sufficient amount of time to interact with each other in order to develop caries. And that is where the acidogenic theory went on to evolve, or rather develop into what is now described as the multifactorial theory for dental caries. Okay, so what does this theory actually say, right? So what this theory basically um, puts into perspective the concept of dental caries. So in order to for caries to begin in on a tooth or in the oral cavity of an individual, first of all you need a susceptible tooth surface. So what do you mean by a susceptible tooth surface? When we look at a susceptible tooth surface, we mean that a surface of a tooth, okay, which probably has deep fissures, which has deep pits, which has buccal pits, rough edges, etc., right? So what happens is when you have this susceptible tooth surface, the cariogenic bacteria, right? Bacteria which are responsible for the development of dental caries find a nidus, an area where they are able to harbor themselves. right? And when the individual actually consumes a high sucrose diet, okay, then that gives the energy to this bacteria to break down the sucrose into fermentable byproducts leading to organic acids. These acids cause demineralization and eventually caries, as I've just explained. The most important point here is the time factor. That means all these three need to interact together for a sufficient amount of time. That means if we intervene in the time factor by frequently brushing our teeth, we are breaking this chain of interaction between these three components in the multifactorial disease theory, right? So this also explains why the current concepts of oral hygiene, right, and prophylaxis is there in terms of preventing dental caries. Okay, let's look at the role of microorganisms. So it has been identified that in a cariogenic individual's oral cavity, the most predominant cariogenic bacteria is Streptococcus mutans species. Under that, the most highly predominant species would be the Streptococcus mutans. Now, just academic interest, there are 5 genotypes and 8 serotypes of Streptococcus mutans. All the other Streptococcus species, that is the Streptococcus salivarius, sanguis, meteor, biliary, etc., have a less cariogenic potential, okay, but are also part of the flora. Other organisms that are responsible for dental caries is Lactobacillus species. Again, it has a more progression role than an initiation role. Actinomyces species, especially Actinomyces viscosus, is identified as something called as the pioneer organism. That means it is the organism that is present at the advancing front of an caries lesion. Similarly, we have the Veillonella species. So these are the primary microorganisms that are actually responsible for dental caries. And this is just a light microscope picture of Streptococcus, okay? And this is the color enhanced image of a color enhanced electron microscopic image of Streptococcus. So the word strepto itself means in a string like arrangement, and coccus is a term used in microbiology to describe the appearance of bacteria which looks like a bunch of grapes. Now this is the again light microscopic view of lactobacillus, and this image at 10 o'clock position is color enhanced electron microscopic image of the same. Okay, so now we know about the factors that are responsible for dental caries, and we've looked at the microorganisms in particular. Now these microorganisms are part of what is called as dental plaque. So let's look at dental plaque. So what exactly is plaque? So plaque is the soft non-mineralized bacterial deposit which forms on the teeth and dental prostheses that are not adequately cleaned, right? So I'm sure you all know what dental plaque is, but to just make you understand from a layman perspective, if you sleep without brushing your teeth, next day morning, if you run your fingernail over the the enamel surface of the tooth, you will find a deposit that comes onto your nail, okay, which is soft and not mineralized, and that deposit is basically what is dental plaque. And if we further delve into the concept of dental plaque, it is composed of various components. Number one is acquired pellicle. Obviously, there are microorganisms, carbohydrates which have been derived from the remnants of the food that the person has eaten, calcium and phosphates, and various other components which are derived from the saliva. Okay, so these bacteria, basically the formation of dental plaque, it requires number one bacteria to attach selectively to the salivary pellicle, okay, and this bacteria they accumulate via specific adhesives and coercive interactions, which is basically electrostatic interactions due to which they adsorb onto the enamel surface. Following this accumulation of the bacteria onto the enamel surface, what happens is the food substrate is broken down. So sucrose is broken down into fructose and glucose, and that glucose is further broken down into glucans and fructans because of bacterial enzymes that are present. Right now, these dextrans, mutants, levans, and polyfructans basically are extracellular polymers that adhere to the adhere to the tooth surface and form the plaque. Okay, so I will explain so that now when we look further at plaque formation, the term that we use is called ecological succession. So the salivary glycoprotein adsorbs onto the tooth surface to form the pellicle, right? And in this pellicle, number one is you have a certain set of bacteria, that is the Streptococcus sanguis and Actinomyces viscosus, which are pioneer species that colonize the tooth right after cleaning, right? And basically, when we use the term ecological succession, what happens is as the thickness of the plaque keeps increasing, there are different types of bacteria that colonize it, right? So now this arrow actually shows you the plaque deposit on the tooth. So if you use a if you use a probe or dental probe or just even your fingernail and run over it, you're going to get that white soft deposit, which is described as plaque. Okay, now these once this plaque and the has started to form along with the microorganisms that are colonizing the plaque, right? It begins to alter the environment at the tooth surface, allowing species like Actinomyces, Veillonella, followed by other filamentous bacteria that come in. So basically, as the thickness of plaque increases, there are different types of species of bacteria that are able to colonize. This is because of the availability of oxygen, right, and the availability of the energy source. That is basically whether the organism the deeper in the organisms that are deeper in a dental caries lesion usually are anaerobic organisms, whereas on the surface on plaque are basically the aerobic organisms, right? So thus further decreasing the pH and oxygen tension, helping spirochetes to enter the plaque. So as you know, spirochetes are anaerobic organisms. So deeper the lesion, the more anaerobic the organisms that we have in plaque, whereas on the surface we have aerobic organisms. This is a color enhanced image of electron microscopic image of dental plaque, right? So this is the various organisms, all right? This is the matrix of plaque, okay? So finally, it is believed and has been identified through research that supragingival plaque reaches full maturity, and there would be 2 into 10 to the power 11 bacteria per gram of plaque, right? So that's the amount of bacteria that thrives in plaque, and that's also the reason why it's important to actually clean our mouth frequently, right? So plaque that's allowed to accumulate for longer than 24 hours can produce oral disease, and so the daily removal is advocated. That is, so this is the logic, or rather the rationale behind the concept of brushing twice daily. Okay, so with the concept of brushing twice daily, every 12 hours, you are mechanically intervening, breaking the interaction of the tooth surface, the microorganisms, and the substrate uh, in a longer time duration. So you're breaking their interaction. You're breaking the time factor over here with the fact that you brush twice daily. Okay, moving on, let's look at the role of carbohydrates. So when we look at the role of carbohydrates, there are various different aspects to it. It depends on the type of the physical form of food that you eat. Are you eating refined if you eat refined carbohydrates that are high in sucrose, you're more susceptible to caries as compared to eating products that are um, more less processed, right? Frequency of ingestion is also an important factor. For example, if there's a bar of chocolate that you're looking at, right, and if you constantly keep eating that bar of chocolate for over the course of the day, multiple small pieces of it every half an hour to 1 hour. What exactly happens is every time you introduce the piece of chocolate into your mouth, you're actually giving additional source of substrate to the bacteria to produce fermentable products, thus constantly ensuring the oral cavity to have an acidic pH, making it more susceptible to caries, right? Whereas on the other hand, you have another person who eats the entire bar of chocolate at one time, right? Goes ahead, takes care of rinsing his mouth. After that, he or she is lesser susceptible as compared to a person who frequently ingests. So the frequency of ingestion is relevant in this way in caries progression. Okay. Now, chemical composition again is basically in terms of refined products, processed products, right? So, if you are chewing a piece of sugar cane, well, that has sucrose, but also that is in a liquid form, right? And it is also it will not stick to your tooth surface, and it is also um, it is not processed, right? Whereas when we look at a bar of chocolate, right, it is sticky, it has more refined sugars. When we say refined sugars, it makes them easier for the bacteria to break down using the bacterial enzymes into fermentable products, giving rise to organic acids. Okay. So again, the route of administration and presence of other constituents in carbohydrates also affect dental caries in the similar format that at the Zab just explained. Okay, so let's look at the metabolism of S mutans. Why we're talking about S mutans only because it is basically the most important organism in the Streptococcus species, which is responsible for dental caries, right? So Streptococcus mutans breaks down sucrose into lactic acid, right? It breaks it down into lactic acid, which is an acid which turns the pH to negative, which turns the pH to acidic in the range of 4.2. Okay, now in the process of breakdown of sucrose, right, so it leads to breakdown into in the presence of these bacterial enzymes, glycosyl transferase and fructosyl transferase. They break down into glucose and fructose, and then the glucose and fructose are further broken down into glucans and fructans, which are the extracellular polymers. Now these glucans are further broken down into mutants and dextrans, and there is a byproduct of this entire metabolism, which is lipoteichoic acid, which increases the adhesiveness of the bacteria to the plaque. These acids, okay, now the acids, when we're talking about lactic acid, which is the main byproduct here, which is produced by Streptococcus mutans, there's more acids produced by this as compared to others, as I mentioned. These they reduce the pH of the oral cavity and cause demineralization of the enamel. Other byproducts that are formed as part of fermentation are butyric acid, propionic acid, succinic acid, and ethanol. All right. So these acids and these alcoholic derivatives are primarily the reason why we develop bad breath the longer we do not brush our oral cavity, right? Not brush our teeth. So principally, gram-positive cocci and gram-positive pleomorphic rods are responsible for the development of dental caries. Okay, and the core concept of dental caries basically is bacteria is when it interacts, when it has sufficient amount of sugars and has the areas where it's able to thrive, then their interaction leads to the fermentation of sugars into organic acids, primarily lactic acid, which reduces the surface pH of enamel, right, to 4.2, right, which is the pH at which demineralization starts. And when demineralization starts, the inorganic component from the enamel is leached out into the saliva. Slowly, the inorganic component is greatly reduced, thus making the structure weaker, giving the organic component, leading to the destruction of the organic component and leading to dental caries. Okay. So this is basically again the same Venn diagram. So if you look at it, the tooth is required, bacterial flora is there, substrate is there, caries is formed when there is interaction for sufficient amount of time. Other factors that are responsible are flow rate, pH, other factors are saliva, as flow rate, pH, buffering capacity, and the pH composition. So when we look at composition of the tooth in the concept of dental caries, right, the surface is more resistant because the tooth enamel is made up of hydroxyapatite, all right, and when we use fluoridated toothpaste, fluoride ions they adsorb onto the surface of enamel, they get embedded into the hydroxyapatite crystal, leading to formation of fluorapatite crystals, which is more resistant to acid degradation. Okay, and that's the reason why fluoride is advised in our for clear for toothpaste. Okay, another process that takes place is post-eruptive maturation. Okay, where the composition of the tooth it becomes slowly resistant as the longer the time it is in the oral cavity. When you look at the tooth morphology, how is that affected? Teeth that have deep fissures, grooves, and pit, as I mentioned to you, okay, are more susceptible to dental caries. Okay, when you look at them, the most common tooth that have highest number of fissures and grooves is mandibular first molar, followed by maxillary first molar, followed by mandibular second molars and maxillary second molars. And this clearly indicates why we see caries more frequently in these teeth, okay, dental caries. Mandibular incisors in canines, on the other hand, are less likely to develop caries because their morphology is that of a self-cleaning surface, right? There are no pits and fissures, right? They're more smoother surface, and thus there is less adherence of the bacteria on these tooth surfaces. The other aspect of when you look at tooth in terms of dental caries could be malocclusion, right? So if you have severe malocclusion, basically it leads to areas in the oral cavity where which are hard to clean by brushing, and they become a nidus and a foci where bacteria is able to thrive, giving rise to the whole concept of dental caries. But this is actually a minor factor. Right, so let's look at saliva. Okay, just broadly, it's composed of organic and inorganic components. Organic components are primarily enzymes and other components. Okay, in the inorganic components, the most important factor of saliva is calcium, phosphorus, bicarbonates, biphosphonates, fluorides, and chlorides. Now, saliva. When we talk of saliva, the most important factor of saliva, which is important in the concept of dental caries, is its capacity of buffering. Right. So when we say buffering capacity, it means the capacity of saliva to neutralize the acids. All right. And this is happening because of its inorganic and organic components. All right, and the pH, right? So pH of saliva is usually neutral, okay, but if depending on the acidogenic bacteria present, the number of acidogenic bacteria present in the oral cavity, the pH could could go down to the acidic pH, all right, and the role of saliva is to try and buffer it, to try and neutralize it. And if the pH and buffering capacity is activity of saliva is not working, then it is going to lead to initiation and progression of caries. Okay, so the effect of saliva is directly related to the quantity of saliva. Okay, so which is described as hyposalivation or hypersalivation. So patients who have hyposalivation have dry mouth. So when they have dry mouth, because of various different reasons, you could have local causes, you could have systemic causes, right? You could have various other causes. So when you have a patient who has hyposalivation, the problem with that is that the washing off effect of saliva is not there on plaque. The buffering capacity is function is not there, just leading to a high caries index. On the other hand, the patient who has hypersalivation, okay, there is increased washing off effect, all right, on the plaque, and the buffering capacity is there. So these patients who have hypersalivation generally have lower caries index. Okay, viscosity and antibacterial properties. Okay, now saliva that is highly mucinous, is highly viscous and is contributes to high Caries index. Okay. On the other hand, saliva also has antibacterial properties because of the presence of lysozyme, salivary peroxidase system, and immunoglobulins, which is called salivary immunoglobulin A. And these three components are responsible for the antibacterial properties and are also responsible for anti-carious properties. Okay, so in different persons, depending on their risk to caries, the function of saliva is also related to the caries development and progression. Okay, so I leave you in this lecture with a quote, a famous quote on saliva. Okay, so it is famously said that saliva lacks the drama of blood, the sincerity of sweat, and the emotional appeal of tears. But nevertheless, it is an important diagnostic tool. And we will all agree that today, in the COVID pandemic period, the saving grace that has come in terms of rapid testing is the salivary diagnostic kit, right? Which saves the patient from the pain of the swabbing, the nasal swabs that we all have to undergo. And in fact, saliva as a diagnostic tool has a great potential, and there's a lot of research that is being done, and there is a lot of future research scope as well. Okay, so although it lacks the drama of blood, but it does have a lot of potential in terms of being a diagnostic tool that could easily provide sample to be able to determine the various health indicators of human being of a person of a human being, um, maybe in the future. So thank you very much. In the next part, I will discuss the pathology of dental caries and explain to you the Stephens curve before we move forward.